Hello, Colorado Chiropractors. It's me again, Dr. Craig Pearson. I am your president of the Colorado Chiropractic Association. It came to our attention a few weeks ago, prior to our last board meeting, that through the Chiropractic Chronicle or Chronicle of Chiropractic, I believe it's an online newspaper for chiropractors, and in this particular article, it came to our attention that I believe it's the College of Chiropractors in British Columbia, which essentially acts as their association and board of examiners, has banned the use of x-rays for chiropractors for diagnosis of adjustment of a subluxation and therefore a treatment program of adjustments. So this was, drew the attention of a number of chiropractors, and then there was a resolution put out by the FCLB. FCLB, which I alluded to earlier in another video, is the Federation for Chiropractic Licensing Board. So this is a United States thing, and the College of Chiropractors of British Columbia is obviously a Canadian thing. So we don't have any jurisdiction over Canada, but we are concerned for our colleagues up there who practice chiropractic in British Columbia. And so it obviously drew our attention to this. And this particular article that was written, the article's name is Alliance of New Mexico Chiropractors issues position paper on FCLB resolution regarding material risks of x-rays. Now, once you get into the article, it doesn't just address the material risks of x-rays. The way it's presented by this article, it kind of says that the FCLB is supporting the Canadian position, or the British Columbian position. So I did a ton of research on this and found out, as I did my own research, that in actual fact, that's not what the FCLB is saying. And so it came to the board's attention, your Colorado Chiropractic Association board, and we discussed this and found that we were actually fully in support of the FCLB. Now, before you get too excited about this, because I know some people are quite excited about this, I will clarify what the FCLB actually said. And first off, I'll read a few things from the article, the Alliance of New Mexico Chiropractors issues position paper on FCLB resolution. And this goes on like this. The Alliance of New Mexico Chiropractors has issued a position paper on the recently adopted resolution by the Federation of Chiropractic Licensing Board, FCLB. The Federation of Chiropractic Licensing Boards voted on and adopted several resolutions on May 1st, 2021. They did do that. One of those is a resolution regarding the taking of radiographs by chiropractors. In light of the recent amendments passed by the College of Chiropractors of British Columbia, where x-rays for the analysis of vertebral subluxation have been banned, all chiropractors should be especially concerned by this action from the FCLB. So I then got into what did the FCLB actually say. So the resolution 221 did in fact happen on May 1st, 2021 at a virtual meeting. And I happen to know some of these chiropractors, and I was blown away that they might be brought to task over this resolution. Anyhow, the resolution reads like this: radiographic imaging and chiropractic practice. Whereas the chiropractic paradigm is based on the association between physical structure and biomechanical function of the body and its influence on neurophysiological integrity. Whereas radiographic imaging is well established in healthcare for evaluating the structure of the skeletal system, its functional articulations and soft tissues. Whereas doctors of chiropractic are educated and trained in the use of radiographic imaging, its clinical indications and contraindications, and the inherent risks of ionizing radiation. Whereas radiographic imaging is a valuable diagnostic tool for identifying structural anomalies, abnormalities, and pathologies of the spine, pelvis, intervertebral disc spaces, and joint spacing, including extraspinal structures, whereas most chiropractic therapeutic techniques apply mechanical forces into the body structure and articulations, whereas information obtained from radiographic imaging is clinically relevant and could be pivotal for doctors of chiropractic to arrive at an accurate diagnosis and an appropriate treatment plan, whereas visualizing structural and articular anomalies, abnormalities, and pathologies are important for manipulative forces to be administered in an appropriate and efficient manner. Now, therefore, be it resolved that the Federation of Chiropractic Licensing Boards, FCLB, recommends, 1, that the use of radiographic imaging in patient care is at the professional judgment of the treating doctor of chiropractic and determined in conjunction with the patient on a case-by-case basis. And point 2, that prior to obtaining radiographic imaging, a treating doctor of chiropractic will inform the patient of the benefits, options, and material risks of X-ray and will receive consent from the patient to be X-rayed. And point 3, that chiropractic care policies and guidelines that impose practice standards based on parameters of time before a doctor of chiropractic may obtain radiographic imaging potentiates an unnecessary delay which can adversely affect the efficacy of patient care and their health as consumers of chiropractic services. That was at the 94th Annual Congress virtual meeting, May 1st, 2021. So when you read into this, the article Alliance of New Mexico Chiropractors slams this particular resolution when in fact this resolution is everything we want to have as chiropractors to radiograph patients. And so I broke it down. In other words, the resolution from FCLB on chiros using X-rays, technically, so this was in response to one of my board members who sent this over to me and with the concern. Technically, he was concerned that MDs don't have to meet position 2. So this actually is required. A medical doctor does have to require your consent before treatment. And so technically the MD does have to do that, and technically you do too as a chiropractor. This was taught in every chiropractic college and was part of passing the boards to become a chiropractor wherever you practice in the United States, not just Colorado. As you would, would do any first-time chiropractic patient, you would get a consent to care. Besides, this is not a law, it's a resolution. In other words, this FCLB is a resolution. There's no law related to this whatsoever. So if you look at the first statement, starting with whereas, that is the definition of a subluxation. Now, the second statement, starting with whereas, states that X-rays are used to evaluate the first statement. The third statement with whereas then says, chiropractors are specifically trained to do this very thing. The fourth statement with whereas, X-rays are an important tool for said chiropractor to look at first statement all over the body, in other words, all parts of the body. Statement number 5, chiros use force. The sixth statement says it's important for said forceful chiropractors to use said X-ray to determine diagnosis and treatment plan. And the final nail, statement number 8 says chiros with the above ammunition of said X-rays determining all potential subluxations and other anomalies can then select appropriate adjustment to fit the need of the patient. Now, therefore, be it resolved that point 1, it is up to the professional judgment of the chiropractor to determine with the patient on the need for said X-ray. Point number 2 says, one should say to the patient, this is a radiating device. Example, could you be pregnant? Point number 3, should said doctor wait for the X-rays or imaging for a later time, this may adversely affect the care of the patient, i.e., let the chiropractor get on with what he or she is trained to do. So I don't know of any other better way to say to anybody who challenges us on radiographic use for the care of our patients than this resolution. So this particular board of the Colorado Chiropractic Association fully supports Resolution 221, and any discussion to otherwise would be in contradiction to how we practice as chiropractors and need to use X-rays. So we fully support it. And with that, I'm going to encourage everybody to continue working as the resolution suggests. Strength, vitality, and health to all chiropractors.